I'm Dr. David Kohler. I'm a metabolic geneticist who works here in the state of Alaska. And I'd like to talk to you today about the CPT1A Arctic Variant. My goal is to explain what the Arctic variant of CPT1A is, and also to talk about what do you as healthcare providers need to know about the CPT1A Arctic variant. The CPT1A Arctic variant, or Arctic variant, is a form of a gene called carnitine palmitoyl transferase 1A, or CPT1A. This gene is essential for burning fatty acids to generate ketones during periods of fasting when there is no other sources of fuel available. The Arctic variant is a single nucleotide change in the DNA sequence of the CPT1A gene that affects the function of the enzyme. The Arctic variant causes a decrease in the activity of the CPT1A enzyme and a reduction in the rate at which fats can be burned to generate ketones during periods of fasting. After a meal, we rely on the foods that we've just eaten as a source of energy. After that, for about the next 12 hours, we rely on our liver glycogen stores as a source of fuel and a source of glucose for the rest of the body. At about 16 hours of fasting, we start switching over, and now we start burning fats and generating ketones. It is this process, the burning of fats to generate ketones during fasting, that is impaired by the Arctic variant of CPT1A. The first thing that happens is that the level of free fatty acids in our bloodstream goes up, and this is a result of breakdown of triglycerides by lipase in our tissues. Those free fatty acids are taken up by the liver and burned into ketones, which are then released into the blood circulation and serve as an alternate fuel and therefore decrease the need for glucose by the body. And as shown at the bottom, those fatty acids are converted to ketone in a reaction that requires CPT1A. This next graphic shows what happens when there is no CPT1A activity. The free fatty acid levels increase, again, at about 12 hours, but you can see that there's no associated rise in ketones. And if there is no rise in ketones, that means the only source of fuel left for the body is glucose. And since there's no liver glycogen left, body essentially runs out of glucose, and then hypoglycemia can develop. The Arctic variant was first identified in Alaska in 2003 following a change in the method used for newborn screening. It was soon learned that it's found almost exclusively in Alaska Native people, particularly those who live in the northern and southwestern parts of Alaska. In some populations, such as the Yupik and Inupiaq Alaska Native people, it is actually the most common form of the CPT1A gene, or the normal form of CPT1A. The Arctic variant has also been found in other indigenous subarctic populations. This includes Inuit people of Greenland and Canada, as well as indigenous people of eastern Siberia. The Arctic variant is very common in these populations, and it is believed to have been beneficial for people living in the far north that ate a traditional subsistence diet containing things such as seal and salmon and other foods that were very high in polyunsaturated fatty acids. Like most of our genes, we all have two copies of the CPT1A gene, one that we get from our mother and one that we get from our father. Children that are homozygous or have two copies of the Arctic variant form of CPT1 have a reduced ability to generate ketones from fatty acids during periods of fasting. During an illness with fever and reduced intake of fluid and calories, these children are at increased risk for having problems such as hypoglycemia. There are a few things that you should remember about the Arctic variant that can help both you and your patients avoid any problems. First off, that the Arctic variant does not have any effect on the ability to sense hunger. Therefore, children don't need to be on a specific schedule or told when to eat. They will get hungry on their own and demand food themselves. This also means that infants and young children don't need to be woken up in the middle of the night in order to be fed. There's also no need for children with the Arctic variant to eat any type of a special diet. Although they have a reduced ability to burn fats during periods of stress, it does not affect their ability to burn fats when they are well. Many parents ask whether the effect of the Arctic variant on burning fats means that their child will be fat. You can reassure them that this is not the case. Even though the Arctic variant affects how fast they can burn fats when they're fasting, it doesn't affect the ability to utilize fats when they are well and eating a balanced diet containing fats, protein, and carbohydrates. But there are times when you do need to be concerned, and children are at risk for having problems. The greatest risk is when infants and young children are sick, particularly if they have a fever, vomiting, or diarrhea, and aren't eating regularly. It's also important to keep in mind that children who have to have surgery or dental procedures, that means they can't eat or drink, are also at risk of problems. As with any other children, their parents should encourage frequent intake of small amounts of food and liquids containing sugar, such as juices, or other sources of carbohydrates. Parents should contact their child's healthcare provider if their child or infant is unable to eat for more than 6 to 8 hours, or is acting very sleepy and can't be woken up. If their young baby or child is jittery or showing signs of altered mental status, they should also contact their healthcare provider. As I've already mentioned, fever, vomiting, or diarrhea that affects the child's ability to eat and drink are times of concern. If their baby is too sleepy or irritable and won't eat or can't be woken up, then they should definitely contact their healthcare provider. Surgery or dental work are also times when they should consult with their healthcare provider for advice on how to manage those procedures. The good news is that all symptoms associated with the Arctic variant can be completely eliminated by providing a source of carbohydrates. In children that are ill but still able to drink, providing juice or Gatorade or other sources of sugar can often prevent any problems or the need for any medical visits. If a child is sick and cannot take any fluids on their own, IV fluids containing glucose will also eliminate any concerns of symptoms from the Arctic variant. Finally, it's important to remember that the Arctic variant is the normal form of CPT1A in many Alaska Native people, and in most, it will never cause any problems or symptoms.